Can you have vitamin B12 deficiency when your blood shows that you have normal B12 levels? When you work with a lot of patients with neurological issues, one of the things that we have to be aware of is the fact that vitamin B12 deficiency can be the cause of some of their symptoms. This is especially true for patients with fatigue, dizziness, lightheadedness, cognitive difficulties, and issues related to anemia. For most people, when we suspect B12 deficiency, we could usually tell from their history because they'll usually be eating a vegan diet or they have a history of some type of malabsorption problem because they have Crohn's disease, ulcerative colitis, or some type of issue that affects the gut causing malabsorption. Even without a good history, a lot of doctors can simply just order a vitamin B12 blood test and they can look at their vitamin B12 levels to determine if someone might be B12 deficient. But the problem is that test may not be as sensitive towards deficiency as we would like it to be. This is especially true for a condition called pernicious anemia. Pernicious anemia is an autoimmune disorder in which the body produces antibodies that either attack cells in your stomach called parietal cells, which produce something called intrinsic factor, which is an enzyme that basically binds to vitamin B12 from our diet. So when B12 gets into our intestines, it's better able to be absorbed by the small intestines when it's bound to that intrinsic factor. Patients with pernicious anemia can develop B12 deficiency because their lack of intrinsic factor to bind B12 is going to limit how much B12 can be absorbed from eating normal healthy sources of B12, which is usually going to come from meat sources. Diagnosing someone with pernicious anemia usually is based on the fact that they have low vitamin B12 levels in their blood, but the blood test may not be accurate in patients with pernicious anemia because they have these antibodies that attack intrinsic factor, and the blood test may actually read those antibodies as levels of vitamin B12, which means that they are overestimating someone's B12 levels because they're picking up on that intrinsic factor antibody instead of the B12 level itself. There are other ways of telling if someone is physiologically B12 deficient. So part of the B12 metabolism cycle involves the use of compounds called methylmalonic acid and homocysteine. So if someone is B12 deficient, their methylmalonic acid levels are usually going to rise and their homocysteine levels are going to rise. So what that means is if someone has normal levels of B12 on their serum blood test, but their methylmalonic acid and homocysteine levels are high, it means that that person is likely B12 deficient and that serum blood test is not actually a true reflection of the person's physiology. All of that to say is that if you are generally not feeling well, you've ruled out a lot of other causes, you have many of these symptoms, and you've taken just a baseline serum B12 level, then you may want to consider asking your doctor to order methylmalonic acid and homocysteine to see if those serum B12 levels are not actually a reflection of your physiology, because some of these symptoms can be improved upon by either increasing your levels of supplementation with vitamin B12 or getting B12 injections in order to bypass the stomach in the case if you have a situation where you might have pernicious anemia.